Pearl is a almost 12-year-old female golden retriever. I noticed that she was just limping a little bit. You could tell that it didn't feel good, so I took her to the vet. He said she's going to need surgery.
TPLO, which stands for Tibial Plateau Leveling Osteotomy. It is a surgical treatment for dogs who have torn what we call the cranial cruciate ligament, which is essentially the ACL in humans.
The veterinarian here in town recommended that we go to CVETS. They said they were one of the premier facilities for this kind of surgery. And I talked to a friend of mine who was a former veterinarian and a very well-respected one, and gave them glowing reviews. So that's a pretty hearty endorsement.
We opened as a family-owned practice because one of the things that we felt like was very important was to be able to connect with our staff and our clients in a very authentic manner.
You have such a good feeling when you pull into the place. The grounds look nice. You walk in, they greet you right away. You see the vet right away. They just really made you feel comfortable. And it's not only to me comfort, I want to feel confident in these people too. You know, I asked the doctor where she went to vet school. Like I said, this is a family member.
In the surgery, we make a small circular cut to the top of the tibia or the shin bone, and so that knee's going to be stable in the future forever. A small little metal plate and screws goes on to help hold it in place while it heals. When dogs get through the recovery, we're really confident in telling people, all right, so that knee is fixed now, and he's going to be strong and solid on that leg.
She stayed overnight, came back and picked her up the next day. They said the surgery went well.
And then when we see them at that 2-week recheck, and they're almost back to normal at that point in time.
They're starting to put some weight on that leg, starting to get used to it.
And at the 8-week recheck, they usually drag their owners into the hospital. They get their x-rays done, and then they drag their owners back out of the hospital because they are ready to go. And that's one of the best things about being a veterinarian.
I'm not a doctor, but her recovery was remarkable. We had to hold her back. She wanted to do more.
They love to play. They want to go for walks with their owners. They want to jump in the bed when it's time to go to bed. And those are very, very important things for quality of life, both for dogs and for owners, which I think gets missed a lot of times.
2 months after the surgery, Dr. LaFoc looked at her again and gave her a clean bill of health to start joining me in the field. And the next day, she and I went duck hunting again.
And so to see both of them get that back is just amazing.
She recovered beautifully, and now she is back to going hunting with her family and doing all of her normal things.
Those dogs need to hunt. That's what they live for. They're not happy sitting on the couch at home. And so to get that dog back to hunting is awesome, but that client also needs that dog to hunt. That's what they do to relax.
I like TPLO surgeries. They're one of my favorites. You know, if their knee hurts and they can't run, that's sad, but then when they get to have their running buddy back again and get back to doing what they love, so it's really nice.
She and my wife walk every day, and there's no way she could have done that without the surgery. It's given her life back. From a service standpoint, from the quality of the work they did, the follow-up, all those things. You sort of run out of superlatives if you're not careful trying to describe them.